Good morning, everyone, and welcome back to the Moms Like Me podcast powered by Support Now. Today, I'm joined by Molly Trexler, who is a pediatric nurse practitioner in Austin, Texas, who has just a wealth of knowledge, all things pediatric disease and surgeries, and just a total expert in this field. And along her journey of being a PNP, she's also endured her own life challenges and her own set of things that came out of left field for her that has both reshaped the way that she approaches her job on a day-to-day basis. And so I thought bringing Molly on would be the perfect guest for the Moms Like Me podcast because she really does hold both the practical practitioner space as well as the mom and the relatable mom that knows what it's like to be in these spaces. So Molly, welcome to the podcast.
Thank you so much for having me. Pleasure to be here.
Yeah. So first of all, Molly, I'm just curious. I'd love to learn a little bit more about what inspired you to pursue a career as a nurse practitioner.
That is a great question. So I was in the early ages of pediatric nurse practitioners. And so when I was a bedside nurse, I recruited to the ICU and found that that's where I loved bedside nursing. And one of the nurses that I worked with actually came up to me and was like, "Hey, I'm going back to get my master's and I think you should too." And I was like, "Okay, tell me more about it." And there's a nurse practitioner. We're going to be the first nurse practitioners in this hospital if you do it. And I think it would be great. We'd be a great, because we didn't have residents. So we would be filling a gap in the need of the hospital. So I literally walked in my application on the day that it was due down to University of Texas. And she was like, "Well, this is last minute." It was like 3 o'clock on the day that it was due. And I just saw the gap that was there on how you could be the bridge between the bedside nurse and the physician. Physicians have definitely one kind of line of thinking and nurses have a different. And so to marry those two seemed like a dream come true for me, where I could take my medical skills to a higher level, but then be the person that the parents need.
I think that's amazing. Can you elaborate a little bit more on, because I think that oftentimes we conflate, nurses with doctors or with nurse practitioners. Like, what's the easiest way to explain to someone the differences and kind of like the strengths of each?
Sure. So, bedside nursing is directly taking care of the patient day to day, following the orders provided by the nurse practitioner or the physician, and doing the moment to moment monitoring of the patient, minute to minute, hour to hour, things like that, where they're really digging in deep on doing the ins and outs care of the patient. And they are absolute saints. So much of care hinges on bedside nurses. A nurse practitioner is at least a master's or doctorate level prepared nurse who has gone through extra training to be able to diagnose and treat. So we can take a look at a patient, diagnose them, for example, with an ear infection and prescribe antibiotics, much like a physician would. So we extend the ability to provide care beyond the bedside. So that's the biggest difference. So then there's the nurse practitioners and PAs are often confused. We're both advanced practice providers. Nurse practitioners can function on their own license and provide care. Physician's assistants are directly linked to a physician, and we both extend the care of a physician, if you want to put it in simple terms.
Yeah.
But we're that in between in the hierarchy of the hospital, we're in between a nurse and a physician.
Okay. That's very helpful. And then I know that you often talk about really not just your role, but your role specifically in the congenital heart disease department. Was there a reason why you started in CHD? What was compelling about that kind of department or division within the hospital for you?
So during my time as a PDICU nurse, I came to love congenital heart disease because it's an area of medicine that we can make better through surgery. We can give them better physiology. We can give them better, cardiac output. So there's something quite magical about taking something that can be perceived as very broken and making it much, much better. And so that was my very first job out of school, was working with our heart surgeon. So I was taking care of kids before the operating room, in the operating room, and after the operating room. And so I got to share the entire journey with the patient. And it was magical times, being able to see these beautiful little hearts and reconfigure them to be so impactful to the baby was just remarkable.
Yeah. It's like, it's to me when you describe that, like I envision scenes from a movie or from television because it
Mhm.
tends you associate it with like a before and after that, but the after is more uplifting because
Mhm.
you know how dramatic this can change the course of someone's life and just what a miracle it all is that we live in a world where these sort of surgeries can take place with a lot of hope and a lot of optimism.
It is. It's we're living in the time of miracles. And the beauty of it is we're getting better every single day.
Yeah,
We're
that is
getting better at caring for the kids. We're getting better at the surgeries that our surgeons are providing and the care afterwards. It's really remarkable. It's an amazing time to be in the world of congenital heart disease.
what would you say your approach is or was in your role with families? Again, you kind of like you mentioned, and it's why I wanted to get clear on the definitions. You kind of played this like liaison role, but
Mhm,
you're educated.
mhm,
You have a certain pedigree and frankly like legitimacy, right? For like a medical perspective.
mhm.
And you're not the doctor. And families are feeling a huge amount of overwhelm. So, what was or what is your approach with those families, given that unique role that you play and the overall kind of like organizational hierarchy that a family or a patient's journey looks like?
So way back when, I used to call myself the great translator because the surgeon would come in and he was extremely smart and talked at that level. And so he would come in and explain all these things, and I'd be like, okay, catch up with you in a minute. And then I would say, all right, here's what he said. And I would be able to translate it into a way that the parents could absorb it. And it was, you just saw like their shoulders soften and their demeanor relax. They're like, I had no idea what he was saying. And so that's where I think you need the knowledge of how to explain things, and you need the talent to figure out the way that parents receive the information best, because
Mm.
everybody's different. So that's kind of the art of my role, is figuring out how to explain things best for where you're at with it.
Right. And which requires what it sounds like is a great deal of not just IQ, it requires a great deal of EQ. It requires
Mhm.
emotional intelligence to get a sense of are these families, are these caregivers prepared for this information, or how can we talk about this in a way that they can digest, right? Because you can't change the situation that you're in, but you very much play a role in trying to kind of very quickly understand what is their capacity to take on all of this information because, eventually, I would imagine they have to make decisions off of this information.
They do. They do. And part of the courageous part of my role is having those difficult conversations. If things aren't looking good, being able to say, things aren't looking good and I'm concerned. Or, if it's end of life, guiding them through that. How do you want this to look? You know, he's passing away. Go up to the head of the bed and tell him that you love him. And things like that is the real, like, magical moments of being there with a family.
Right. And connecting with them on a human level
Human.
and
'Cause
trying
those
I
moments you don't know what to do,
right.
and you're
And
like, just
you can't change what's happening, but you
mm-mm.
have to try to give the families the opportunity to respond in a way that they don't look back and say, I regret not doing things differently."
Right. You're being
Right.
the voice in their ear. So,
Yeah.
if
So it sounds like based off what you shared and what I've learned and studied or researched about you, Molly, is you're having this incredible career.
Mhm.
You're a mom yourself, and
Yes.
then in a moment, your life changes. Talk to us about that.
So, at the time, I was a nurse practitioner who was in the ICU transitioning to orthopedic surgery, And I had this beautiful 3-year-old daughter named Allie. And all of a sudden, it felt like out of nowhere, but in hindsight, it probably was developing over a series of months. She developed debilitating headaches, and they were scary headaches. Like, as a nurse practitioner, her signs and symptoms were telling me that she had a brain tumor. She would wake up with a headache. She would stop playing and scream, "My head." She would tell me there were crabbies in her head. And so I'm trying to decipher all this information. And so I went through what every parent goes through, which is you go to the pediatrician, they diagnose you with allergies, so you take the medicines, the headaches don't go away, and finally, I just kinda kept pushing and kept pushing, and we got to see a neurologist, and even the neurologist, who I know, she was a friend of mine, she was like, "Molly, I can't explain these headaches," and I said, "I can't either, that's why I'm here." And so we got an MRI, and we found out that she, in fact, did not have a brain tumor, thank goodness, but she had what's called a Chiari malformation, which is where the hole at the bottom of her skull was too small, and it was actually kind of pinching her brainstem, which was causing the headaches. So in that moment, in that instant, I knew she was gonna need brain surgery. And I also knew who was gonna do it and immediately got on the phone, like, "I need an appointment with Doctor George tomorrow." So it was an eye-opening experience because I went through what every parent has to go through when they're searching for a diagnosis for their child, and it taught me so much about the process, and it taught me so much about myself. Afterwards, in the period between diagnosis and surgery, I found myself being real irritable and real controlling. And my aha moment came when I was literally bawling on my couch to my husband. And I looked at him and I said, "I'm just scared. I'm scared to death." And it was like all these behaviors were me trying to control everything, thinking that I can control the fear inside of me.
Mm.
And so it was one of those where, like, okay, what can I control? Which is I can control where she has surgery. I can control who does the surgery. And because I worked at the hospital, I could pick an anesthesiologist. And then beyond that, I had zero control. So it literally, I had to leave it all in God's hands. I controlled what I could. And it was just a relief to not have to feel like I was controlling the world.
Which is so much easier said than done.
It is. It is, but once you boil it down and you say, "I can't control this," there is a relief.
Right? So it's like you have to say it, but then you have to really internalize it because when she's
Mhm.
back in surgery and you're doing all the things, you just know that there it is gonna be what it's gonna be.
It is, and I have a really strict rule about anytime somebody's in surgery, and I say it's positive thoughts only. If a
Yep.
negative thought creeps in, you just absolutely talk to the thought and you say, "No, you're not allowed in my head today.
I
Today
love
is only
that.
positive thoughts."
I love that. So, Molly, before I have a lot of questions, but I wanna walk backwards to something. Something I often hear on this podcast and just in regular conversations with families is that, it takes up families a very long time to get to the root problem with their child or with their spouse or whomever they're seeing kind of this change in health behavior. What advice do you have for parents that you see these signs, you know that doctors have a tendency to dismiss things because I think by nature we don't these things are rare and we don't want to be alarmist, but what advice do you have for parents that find themselves in this in between of like my kid's complaining about this, I'm not really sure. I think I'm not concerned, but how do I get rid of that like slight panic in the back of my head?
That's a great question because it is very, very common, and my advice is to stick with it. I I knew there was something really wrong, and I would tell every parent, "Trust that feeling.
Yeah.
Trust your gut 100% and keep pushing." So, if it means like, for us, we had to go get a sinus X-ray, and I was like, "Fine, I'll get a sinus X-ray." And I read it, as it was being taken, I was like, "It's not sinuses. Can we now move on to the next step?" And oftentimes, because it is rare, oftentimes it can be allergies, and it can be these things that are certainly more common than a Chiari malformation and syrinx. So it's important that the doctor do the correct steps as well. They said that we've ruled out all the common things, and now it's time to move on to the less common. And that usually means moving on to a subspecialist. So I always advise them to stick with it, keep going, keep pushing until you have an answer. As a nurse practitioner, we were taught that if you let the family talk long enough, then you just listen to them, they will tell you the diagnosis. And it's so true.
Yeah.
So, and that's what kind of happened with us.
Well, and I feel like we're in this information era where
Mhm.
parents, fortunately and unfortunately, have so many ways to plug in. Here's what my child is feeling. Here's what their symptoms are. This is
Mhm.
how long it's happened. And so, which can be a good thing in some cases, right?
Yeah.
Because you come to the table with a perspective. It can also be very, very dangerous because I think the internet makes people feel like they are qualified to share what the diagnosis is, which can drive fear and panic. So what is that line? Like, what is the line between doing your own homework? And again, perhaps this is naive. It's like if your kid's not feeling good, you're gonna use the resources you have. Like, who are we to say that it drives panic? Like, you want to serve your child and make sure they're okay. But is there advice that you give for parents in that place?
I do. And I advise them to not Google, which I know they're going to anyways. But what I tell them is that I tell them my story basically, which is I went to the internet knowing that I should not Google, but I wanted to find one good Chiari story. Just one good Chiari story. I needed that piece of hope. And did I find it? No, which only made me more scared.
Right.
And then my daughter had a beautiful Chiari decompression and a successful surgery, and she's 100% normal now. But did I go back to Google and put it on there? I did not.
Yeah. That's actually a really, really good point. It's so easy and it's natural to talk about the bad, the negative. I mean, you hear this about like Yelp reviews. Like
Mhm.
the more
Right.
like you're more likely to share a negative thing than a positive thing because
Correct.
you've moved on and there's peace and closure. It's such a great reminder that just because you're having a hard time finding it doesn't mean it doesn't exist. It just means that
Exactly.
most people don't revisit it, which I think is very interesting. I also find like it's different, of course, but it's similar to labor and pregnancy when women are having
Mhm.
babies and you hear all the scary. I know for me, when I was pregnant with my first, I didn't wanna know anyone's story because it didn't
Right.
matter. Like, it's
Right.
mine. And, yeah, there could be something scary and dangerous and all the things that happen, or it could be totally fine.
Right.
So, I think the suggestion I love the suggestion of, like, seeking the good.
Mhm.
But also not panicking if that is not the abundant majority response and stories that you're seeing, because oftentimes by human nature, it's just not it's not what's compelling to people to share.
Right. And the more you focus on the negative, the more scared you get.
Right.
And you're like, "What if that happens?" Or, "What if that happens?" And what I always use with my coaching is, "What if it doesn't? What if it doesn't happen? What if you get the jackpot and you get the perfect surgery?"
So, Molly, you talked about earlier, it seems I wanna take nothing away from you. In fact, I have a strong suspicion that the Molly Trexler before this happened, as a nurse practitioner, was still extremely kind and empathetic and did all the right things that you knew to do. And what changed after your daughter's surgery, after her brain surgery, about the way you approach situations with families?
Well, first off, you feel like you're part of the club. Right? Your child has gone through something traumatic. You've been on that journey with them. And so you feel like you get it. And in a lot of ways you do. But what really changed for me is that the way I saw parental fear kind of showing up in so many different ways, from either controlling or anger or this or that. And it allowed me to approach them differently. Like, I see you. This is really scary. This is scary stuff that we're dealing with. And I want to let you know that I'm here for you and that we're going to walk through this together. You've got a whole team of people around you who all have the same goal, and that's to be 100% successful for your child. And nothing is ever perfect, But knowing that they have somebody to talk to that they can rely on, who will not necessarily sugarcoat things, who give you the whole truth and nothing but the whole truth, is comforting to them in a way, even if it's hard to hear. So they just know when they're dealing with me, you're going to get all the information you want and need. And if you're not ready for certain information, we take our time.
Right. Right. It's like you let them self-select,
Correct.
to a degree, I'm sure, what information they're ready for and what decisions need to be made because
Hmm.
it is overwhelming and they are dealing with obscure and dramatic situations. I'm curious how has your role or how do you view your role inside the hospital as now like teaching other NPNs on how to handle the kind of the hospital caregiver relationship?
Well, what I've found is that some of the nurse practitioners I work with will just hang around when I'm talking to families.
Mm.
And they're like, I really like the way you talk to families. And so that's like the ultimate compliment when somebody says, I really appreciate the way you talk to parents in difficult situations. And then as a institution, we're working on better communication all the time, like how to be empathetic with families and, provide the information in a comforting way and guiding them through this really often crazy journey.
Yeah, it's that's the other thing that I think people forget. I think because of social media, you look at things in, like, just, like, highlights, and
Hmm.
as a result, people are quick to forget that it's actually a extremely long journey. There's certain peaks along the way that are highlighted, but the information never stops for families. And therefore, they're filtering what's most important to their communities or versus, like, what they're keeping to themselves. My kind of, like, wrap-up questions, I suppose, is I feel like for some people, after they would have experienced a personal encounter with a brain surgery, that perhaps they would say, "You know what? I'm done. I've paid my dues. I've helped families. I've been through this myself. I I'm tired." What what drove you to go back?
It was interesting because, like I said, at the time I was with orthopedic surgery, and I've been fortunate to be recruited into multiple roles. But when I was recruited into neurosurgery, I actually went back and worked for my daughter's surgeon. It was just so meaningful.
Mm.
So, and the other nurse practitioners were great. They're like, you can talk to all the Chiari moms because you get it. And so, because Chiaris are hard to figure out, they often have residual symptoms. It's a difficult condition. I think if you talk to almost any Chiari mom, they would say the same thing. Even now, my daughter still has headaches more than the average person. So, what went back is I just knew I was good at it. I know that I'm good at walking this journey of talking the talk. And to be honest, I would love, and I did, I was fortunate that I had somebody like me with us on our journey.
Mm.
She was a good friend of mine. I had a couple really good friends who were just there for me as my daughter's nurse practitioner and as my, being friends with my daughter's surgeon. I just know that parents need and deserve that.
I also think that that little wrinkle that you shared is really interesting. It's because they were your friends, it's like, I do wonder if they were honest with you in a different way because they cared so much about you, and I think sometimes what families feel when they're in the hospital setting is they feel like they're kind of just going through the checklist,
Hmm.
right? They
Yeah.
they people c not everyone, but some families question, like, "Are you really taking into consideration my child, my needs,
Hmm.
my family?" Because it's a hospital and there's so many patients, and it sounds like for you, what you took from that experience was that in some ways creating a friendship-like trust, which is that I
Hmm.
am going to be honest with you, which is what a great
Hmm.
friend does, right? A great friend isn't one that just tells you what you wanna hear. They're ones that are saying, "You've been a little off lately, are you sure everything's okay?" They push you to transparency, and it sounds like that might have really influenced kind of this newer outlook on talking to families and approaching them.
It's so true. So I tell every mom in particular that I take care of, I said, I always focus on them. How are they recovering? Most of the the babies I take care of right now are newborns. Are you taking care of yourself? And, I said, it's my job to care about you too, because they're a package deal. Any child is a package. And so no matter where they're at in their journey, what I always tell them is you've got to treat yourself like a plant.
Okay.
And that means you've got to get sunlight on your body, water, nutrients, and fresh air every day. Because they'll get into the hospital and they kind of bubble themselves. And I'm like, you have to get out of here. It's better for your nervous system, it's better for your mental health. And doing those simple things, just caring for them when they're willing to do it, it's a tremendous difference in the relationship. They're like,
Right.
"Okay, it's okay for me to take care of myself."
Right.
And I'm like,
Right.
"Absolutely."
Yeah. And again, when you're talking to moms, moms will be the first people to not to victimize ourselves, but we wanna we take on the pain of our children, and so effectively assume that we need to suffer,
Right.
and it's this really weird dynamic that we have, but it's almost like because we can't take away our children's pain, we wanna feel it alongside of them, and
Yes.
that not feeling that makes us less, not worthy, but just, like, less connected, and it's actually the opposite. It's like the more that you can feel
Mhm.
in tuned and at peace, it's like those are the sort of, like, signals and emotions that your children can pick up on that actually
Mhm.
make them feel more optimistic and hopeful because they're picking up on your energy just as much as they are your words.
And moms grind. They're really good at, I call it the grind, where you're like, "I don't care. I will do this for as long as I have to because it's for my child." And
Right.
if they can take a step back and breathe, they're more effective, like you just said.
So tell everyone, I think it's amazing that you're a mom, you are still an NPN, and you have created this entire coaching business to
Mhm.
further extend your perspective and services to parents. Like, what is it? How does it work? Tell us everything.
So I created a program called Heartstrings, where it is a 9-week program where we work one-on-one and basically walk through your journey together. And this is why I'm such a huge fan of Support Now, but it's based on the 4 Ps of faith: pardon, power, peace, and purpose. And one of the things that we deal with right off the bat is building your circle of support so that you are in a position to navigate this journey with grace. Because life events, as you well know, require a lot of support, whether it be financial, whether it be like casseroles and cash, like you've said before, but also the grants and things like that. So, Support Now is a phenomenal resource for these families. But it's a 9-week program where we work together and basically set up all the building blocks you need to have the best possible experience of one of the most terrifying or scary parts of your life. And so it's just been a joy to see people change their perspective and that let go a little bit of the grind and really find themselves in this role that they didn't necessarily choose, but finding a way to thrive in it.
And Molly, you serve people. Do they have to be specific to the Austin area or can they be anywhere? It can be virtual.
Anywhere across the US and abroad. I mean, I can coach from anywhere, and it doesn't have to be congenital heart disease. I'm coaching a mom of a 41-year-old who has a brain tumor.
Wow.
So, the beauty of the program is it works for everyone.
Right. And website, Instagram handles, where can people find out more about you, even if they're not ready for the program, but they want to understand a
Sure.
little bit more about your approach and see your content?
Yeah, thank you. So it's mollytrexler.com, and then on all the platforms, TikTok, Facebook, Instagram, it's at Molly Trexler Coaching.
Amazing. Molly, I am just so glad that we were able to connect and be able to do this podcast so quickly after first meeting. I really value again your perspective. I've learned a lot on this call, even from like a kind of like again a functional like hierarchy role inside of a hospital. Again, I think there's just so much that people don't understand until you're in it, and then now all of a sudden you're trying to figure it out. But of course, hearing
Mhm.
your own experience and how you navigated it is so inspiring, and I'm just so looking forward to deepening our relationship and supporting families alongside of you. So thank you so much for joining us today.
Yeah, and thank you for all you do. I'm gonna be, shouting support now from the rooftops.
We'll take it. Thanks,
Mm.
Molly.
Thanks.